Okay, let's clear something up. Aromatase inhibitors. Everybody should be on an aromatase inhibitor. Nobody should be on an aromatase inhibitor. Jeez. Okay. The decision to use an aromatase inhibitor should be based on the individual in front of you. So, funnily enough, it has to do with estrogen. Testosterone is aromatized to estrogen. The aromatase enzyme is produced in the liver. If you have liver dysfunction, then it causes overexpression of the aromatase enzyme. If you're a chunky monkey, then unfortunately you are more prone to aromatization. Now, if you make a closed statement, nobody should have been a aromatase inhibitor, everybody should have been a aromatase inhibitor, you're an idiot. You are a bad scientist. I have never made a closed statement about the use of an aromatase inhibitor. However, I've been quite proud of the fact that not many of my guys need an aromatase inhibitor. Now, that being said, I am microdosing examestane more and more often. Why is that? Why is that? Well, with microdosing, essentially you really are titrating your dose according to effect. Now, unfortunately, irrespective of having a healthy lifestyle, not being a chunky monkey, not being a heavy drinker, not having any liver dysfunction, we are prone to aromatization. Why are we prone to aromatization? Well, we're surrounded by plastics, we're surrounded by crap, you know. If we were living in the country, hunting our own animals, growing our own food, not exposing ourselves to the tap water that's got estrogen in it from farm animals and women peeing it down the toilet every day, then you can have a puritanical perspective and say, really, you should not be on an aromatase inhibitor. And I would like to not prescribe aromatase inhibitors because I'm a big advocate of less is more, working with nature, not against it. Now, can you have that closed discussion, closed argument? No, you can't. So the decision to prescribe an aromatase inhibitor should be based on assessing all of the parameters in front of you. Now, morons tell you you should lose weight and not use an aromatase inhibitor. Yeah, of course you should lose weight. And the aim is not to be able to, not to need an aromatase inhibitor. But should you be placed on testosterone replacement therapy and suffer the symptoms of high estrogen, breast tissue swelling, nipple tenderness, water retention, anxiety, loss of libido? No! I wanted to be like him. No! You shouldn't. But there is no one-size-fits-all protocol. And your TRT protocol will be an evolving process. So when you start testosterone and you get given a protocol, that's not your protocol for life. You know, with every best will and intention, you are gonna need some tinkering. Most of my guys are stable and don't need any tinkering on a 6th monthly basis. And I'm like, hi, how are you? And they go, perfect. And I go, brilliant. But there are some guys who are prone to aromatization who will need tinkering. If you make a major adjustment to your lifestyle, guess what? You're going to need tinkering. So, I do like the word tinkering. it's one of my favourite words. But it should be done carefully, and it should be done with your best interests at heart. So you can't make a closed statement like you should never be on an aromatase inhibitor. Now, you should aim not to be on an aromatase inhibitor, but if you need an aromatase inhibitor, you should be on one. So part of my issue is, unfortunately, as with all of these monkeys out there, they prescribe things incorrectly. I don't use anastrozole because it's notorious for crashing E2s, because it's irresponsibly prescribed by the morons. So what do? We microdose examestane. Why do we do that? Because it's the most effective way of managing estrogen. Ba-da-bum. Jeez. So, give me strength. Everybody's concerned about aromatase inhibitors now because they kind of go, oh, it's going to lead to cardiovascular problems and bone mineral density problems. Well, why does it do that? It does that because you crash your estrogen. You crash your estrogen because it's irresponsibly prescribed. There's a common theme in the testosterone replacement therapy community. It's like, where do the risks come from? The risks come from not being optimized. They come from these bespoke TRT protocols that are all the same. 1, 2, 5 of sustanon every 5 days. Bada boom, bespoke. Yeah, great. Yeah, that's the whole purpose of this is to bring all of your male androgen levels into balance. Again, that dirty word. But that's the whole point. You know, we are trying to optimize, balance, stabilize, whatever word, normalize, whatever word you want to use. We are trying to normalize your levels. So if you are prescribed an aromatase inhibitor, it's to normalize your estrogen level, to bring it into balance, to have that nice ratio of testosterone to estrogen. So the perceived risks of decreased bone mineral density and cardiovascular disease are because you've crashed your estrogen and it's remained crashed. There's lots of evidence to suggest that actually it's not that dangerous, but we're not talking about crashing estrogens when you prescribe examestane properly. We're talking about normalizing your estrogen level. Now, most of my guys like to have an estrogen level between 90 and 120, but some quite like it up to 150, and they report higher libidos with 150. So, you know, it isn't a one-size-fits-all protocol. It isn't a one-size-fits-all management plan. Some guys need more attention than others because their journeys are different. So, you know, we can't all be Greek gods. We can all aspire to be Greek gods, but you're going to have to work your ass off. You're going to have to address your lifestyle, your nutrition, your exercise. You're going to have to do that with consistency for years in order to be this optimized Greek god that you are sold to believe will happen in 6 weeks on testosterone replacement therapy. You'll get sold a book to optimize your lifestyle. It isn't rocket science. It's addressing the fundamentals of health, which you should be addressing anyway. We live in a really unhealthy society. So just go back to basics. Go back to lifestyle, nutrition, exercise. Address your hormonal health. Understand that TRT is an evolving process, it's a work in progress, and you need to work with your clinician. There are no cookie cutter protocols here at the Men's Health Clinic. We work with you in your best interests. We support you, we guide you. Stop listening to the idiots and do it properly. So, here endeth the rant. I do like my rants. TRT should be prescribed properly, not by idiots, providers. Jeez, people that don't know their arses from their elbows. I'm sick and tired of them. So, should I go on an aromatase inhibitor? Well, you should only go on an aromatase inhibitor if you need one. You should be guided by your prescribing clinician. If you don't know who your prescribing clinician is, geez, that's pretty worrying. I mean, not only for you, but for them. They're the ones that signing your prescriptions. Are they really signing prescriptions? That's debatable. Okay, right. Bespoke HRT. Yeah, properly prescribed HRT.